Hi everyone, welcome to my next video, and this one is on medication management. A lot of people as they get older are put on different medications from different doctors, and all of a sudden they have many medications. It is really important to make sure whenever you see one of your doctors to bring all your medications and vitamins with you to make sure that they're all aware of what each other is giving you. It's also really important to go to the same pharmacist so they also know every medication that's given to you, and they will be able to help you with any side effects out there to make sure there's no drug to drug or drug to food interactions. So it's important to have this information and look at it. Don't take it to heart too much. Side effects are incredible to read on many of these new prescriptions, and so you can get overwhelmed by that. But talk to your pharmacist before you leave. Ask them what should be the side effect that would be most prominent, and are you okay taking this medicine with your other medications? The other thing that's really important is know what time your medication should be taken. Should it be first thing in the morning? Should it be with food or without? For instance, Synthroid or levothyroxine should be taken on an empty stomach in the morning, 30 minutes before eating anything. And this way the medication works better. I've had people tell me that, and their thyroid test would be off, and I'd actually first question would be, when do you take your thyroid medicine? And if they say with breakfast, I say, no, let's not change the dosage yet. Let's take the medicine at the right time of day. We'll check your TSH in 3 to 4 weeks. If it's back to normal or a normal range because you're taking the medication at the right time, you don't want to increase the medication to make the blood work right. So the medicine should be taken first thing in the morning before you eat. The other thing I've also noticed that people with Parkinson's, if they're taking Cinemet or any Parkinsonian drugs, sometimes it's better to have it ready the night before on your bedstand, to have a glass of water and ready to take it first thing in the morning so that you're able to take your other morning pills later. Because due to this neurological disorder, the stiffness with swallowing and moving your extremities could cause you to either fall out of bed getting to your first pill of the morning, or if you're taking other medication, you could actually have some choking. So it's really important to consider taking your Cinemet also before you get out of bed in the morning. If you happen to be on both a thyroid medicine and the Cinemet, talk to your healthcare practitioner how they best want you to take that. There's also some medications you don't want to continue to take indefinitely, such as PPI or proton pump inhibitors. Let's say you had heartburn for a few months and you were given a prescription with a renewal, but you notice the heartburn is gone, and you could try to stop taking the medicine. You would want to check with the doctor who had given it to you whether you can try to live without that medicine, because it is known to reduce absorption because it's an acid blocker in the stomach, and some nutrients will not be absorbed, some medications would not be absorbed, and it also has been linked with some forms of dementia. So if you're on this medication such as omeprazole for years and years, please make sure you check with your doctor if you need to continue or can you stop it. It's also good not to be on a lot of medications. I find that anyone who's on more than 10 medications in the older population, it's considered polypharmacy. So you want to consider reducing medications if you can. It's always good to bring all your medications with you and then talk with your doctor, which medicine do you think we could do without. It's also good to know that sometimes taking a medication makes you feel better, doesn't mean you should just stop it. Sometimes people do that and then they're like, why do I feel so crummy? Well, it turns out that they stopped a medication that they really needed. They just thought they didn't need it anymore because they felt better. So it's the other way around. It's really important that you talk with your doctor before you stop a medication. As far as expired medications, it's important to get rid of them carefully, safely. If they are, you could rip the label off the bottle. You could put all the pills that are expired in one bottle, and you can actually either bring it to a police station and dispose of it there. A lot of police stations are taking the medicine, or you can actually pour it into a Ziploc bag with kitty litter or dirt and throw it in your garbage can. If you have sharps that you're trying to get rid of, there is actually a site called it's a sharp site. It's actually a website that you can go on called safeneedledisposal.org. safeneedledisposal.org. You put in your state and your zip code, and it tells you how you can get rid of it. A lot of people also just take a Tide bottle or some sort of a detergent bottle with a nice screw top that's tight, and they put all their needles in there, and if you seal it with a big piece of tape, you are also in most states allowed to just throw that away. It's also a good idea to have a chart if you're on multiple medications. This way you know when medicines are taken at which times. You can make a chart that says 8 a.m., 12 noon, 4 p.m., 8 p.m., and just make a grid 7 days a week. Put the medicines on your list, and then you could just write, put an X in the box of what time you would take them. It's very simple, and I used to do that with my patients so that they would know, not 7 days a week, but all the medicines for the day. And the night before, they would use a pill box like this and just fill it up. You could get a 4 square one. Some of these come apart. Most of these pill boxes do, so that you can actually take one package with you if you're just gone for the day. And these lids just snap off. You want to make sure you get one that you're able to open. They've made them a lot easier for people with arthritis now, so that you're not stuck trying to open up the lids. If you're traveling, you need to bring your medication on you, not in your carrying bag that's actually in the cargo plane, because if you should lose that bag, you won't have your medication. So just something to think about when we start traveling again. Medications should be kept in a cool, dry place. Basically, a lot of people keep them in the bathroom. Not a good place to keep them. They're better in a kitchen cabinet. And if you take medications at night, you can also bring your pill bowl, little bowl or whatever near your bedside with water and take it then if you want, so you don't forget to take them. There is some devices out there if you do find that you do forget your medication. One's called Medtronics, and it's a box that you can actually get. It's called, Medfolio, and it can be programmed with times, and it will tell you when you need to take your medicine. It's really good for mom and dad who do forget and you're worried that you have to call them every day at noon. Did you take your medicine? The box will keep talking until you open it up and take your pills. So it kind of bugs dad to take his medicine. If you find that it's difficult to be organized with a pill box, some people don't do well, there's a company called PillPak, which is really cool. And some pharmacies are actually being great about getting these devices that actually make spools of your medicine in little packets. So let's say in the morning you take your Cinemet and you take your blood pressure pill. It will be in a package with the names of the drugs on the package. You rip the package off the spool and you just put it in a little cup. It opens easy and you take your medicine. And the spool keeps coming with each time of the day. If you have creams, if you have insulin, they will also prescribe that. It will just be given to you separately so that there's no confusion with the medicine. And if a medicine is changed, they will actually redo the box so that you get all the new medicines in there. Remember also, some medicines should not be cut in half without an okay. Some medicines do not have a score in them, but if you check with the pharmacist, they'll tell you whether or not it can be cut, or do you have to get it scored in order to cut it. You need to check with the pharmacist. They also need to not be stopped abruptly. So you need to make sure that you don't stop medicines or cut them in half without the okay, especially if they have a coating on them that is a slow release pill. Slow release pills definitely cannot be cut because they're given out in a certain amount of time, over 12 hours or so you don't want to cut them. If you need to cut your pills, though, you can get a pill cutter. It looks like this. It's a little tiny device. There's a little slicer in here. I actually do take a pill that needs to be cut, and I checked with my pharmacist, and it can be. And you just push down on it like this, and it snaps it, and then it makes 2 pills. So now I have all these pills cut in half, which is easy to take. If your mom is having trouble taking her medicine in a pill form, you can always crush it. People buy that little bowl, like a mortar and pestle thing, but it's hard to get all the medicine that's in powder form now off the device. So I've actually have in my book, Caregiver Success, that you can take 2 spoons like this. You put your medicine in this spoon like this, and you could just take another spoon, put it on top like this, and just push on it as hard as you can, like that. I could hear it crunching in the spoon. The medicine doesn't go flying everywhere. And then when you take the spoon apart, there it is, all crunched up. You can put in a little cup of applesauce, stir it up, and then mom gets her medication, which is really great because then you know she's actually getting it. Don't put too much applesauce. If you give her a big bowl with a little bit of medicine in it, if she doesn't finish the bowl, she didn't get all her medicine. So just use a little bit of applesauce, enough to take away the taste of the medicine, and down it goes. If you are having trouble getting your medication or you cannot afford it, there's actually a prescription drug plan that many people can get. This is called GoodRx Prescription Drug Savings Card, and it has a member number on it, and you would leave this with your pharmacist. There is a customer service number to get your own card. It's 866-809-9382. If you want, I will put this on my Facebook page, caregiversuccess.com, and this way you'll know where this information is should you want to get a GoodRx card. It gives you discounts on your medicine, and it's always good to shop around when you get new medications because not all pharmacies are the same, not all companies are the same with price, so you want to get the best deal out there. A couple more things we should go over is that childproof caps. If you live by yourself, you could ask the pharmacist to please not put a childproof cap on it because most older people can't get those things open. You have to press down and then turn, and it's impossible. So ask for a cap that's easy for you to use. If you do have grandchildren that come over, you could always put it higher up on a shelf, just making sure it's out of the way. The other thing to really consider is if you're given any medications for pain, like you had a hip replacement 2 years ago and you have a bottle of like 10 oxycodone left, it's really important to consider disposing of that. You never know who's the drug seeker in your family, and it's better to be safe than sorry. All you got to do is take the label off the bottle and give it to your local police station, and they will dispose of that narcotic for you. Another important thing to go over, especially for older people, is that there are a lot of medications that they should actually avoid. First ones are called NSAIDs, or non-steroidal anti-inflammatory drugs. They are not good for the kidneys. They can cause bleeding, and they're difficult for adults for overuse. They can have them temporarily, but not for long-term use. Examples of them would be Aleve, Motrin, ibuprofen, Advil. So make sure you check with your healthcare provider whether those medications are okay for mom to take. Digoxin, it's an old drug. It's been around a long time. It's okay to take, but the highest dose, unless you're seen by a cardiologist or have been told otherwise, is no bigger than the 0.125 milligrams. Okay, so make sure that it's 0.125, not any bigger. There's some diabetic drugs that have also been known to cause long-standing low blood sugars because of their half-life. What that means when the drug has a half-life that's long means that when you take the pill, it takes longer for it to come out of your system. So in other words, you could have a low blood sugar from a drug and you can't raise it for a while. So for older people, glyburide, two of the drugs that need to be watched closely if you're taking those to make sure you don't get hypoglycemia or low sugars. Muscle relaxants, that's another drug that can be problematic for the older population, like Flexeril or Robaxin or Soma. They help with muscle spasms and pain, but they do cause dizziness, drowsiness, nausea, dry mouth, and loss of appetite, and they could cause long-term effects if you're taking them and actually cause falling. So be very careful if you're taking those medicines. Don't drive, stay home, see how you do with the first pill, and talk to your doctor if you're not feeling well with the dose that they gave you, or your healthcare practitioner. As far as anxiety and insomnia, some medications that tend to be addicting and difficult for the older population is Xanax, Valium, and Sonata, as well as Ambien. Be careful. It depends. If your mom is 97 and she's up all night and she's sleeping all day and the quality of life is not good, and she's older, if you go slow, and that's another thing with medicine, you go low and go slow. We start at low doses and then move up to see how you do on them, because people, when they get older, their ability to process drugs and to move them through the liver or the kidneys is limited or reduced, and you want to make sure that they're getting the medication the right way. Some other drugs called anticholinergics should not be taken by older people. They tend to be drugs such as antihistamines for allergies, skin muscle relaxants, things like amitriptyline. Benadryl is definitely off the list because it can cause urinary retention, especially in a man who has a prostate that is enlarged. Ditropan, Zyprexa are some of these examples. Drowsiness, confusion, dry mouth, and constipation. So be careful. Make sure you tell your health practitioner all the medicines you're on. They know how old you are and what is safe for you to take. We've also talked about the oxycodone, but Demerol, Percocet, those are other drugs that are opioids and are very highly addicting and should be used very, very short term, if at all. Estrogen pills are not to be used. They can cause blood clotting. And we should definitely go over Coumadin. Coumadin is a drug that many people are on. It's an antiplatelet drug that works on preventing clotting. When you take that medicine, you need to have a blood test done called a PT-INR, either every 2 weeks or every month, depending on the levels. A normal level is between 2 and 3. If it's below 2, you may need more. If it's over 3, you may need to take less. So that level is reported to your healthcare practitioner, who then will titrate or adjust your medicine accordingly. You need to take Coumadin at night, because if you take it in the morning and then you have your blood drawn, and if the level is too high, you've already taken the medicine, and then of course it's hard to backtrack. So be careful. Make sure you take your Coumadin in the evening, best around dinner time, and even hold the medicine until you get the results of your blood work, so you know that you're safe and that you can go ahead and take your medicine as usual and stop. So I think we've covered mostly everything. I'm thinking if there's anything else that you may have questions about. If you do, you can email me at nancythenp@gmail.com. Kind of ran through this because I don't want to make it too long for you. It's a lot of information, and I will put some on my Facebook page for you. Let's see if there's anything else I could say to you. I think we covered a lot. All right. Also, keep a list of your medicines in your wallet and your vitamins. God forbid you faint somewhere and the paramedics come. It's really good to know who you are, what medications you're on, what your allergies on. So put it in your wallet, because people go looking for that information if you're all alone. So be safe out there with that. Many more information that you may want is in my book called Caregiver Success. Feel free on Amazon or caregiversuccess.com. And until next time, from Nancy the Nurse Practitioner, stay safe. Bye.